Thanks. Thanks, Leslie. That was amazing. All right. That actually taught me a few things. I've been through that site several times, but it has so much information that it's hard to take in one swing. All right. With this related to the supplementation, I mean, we hear everybody's got a vitamin now. There's so many different vitamins. And in my clinic, I have probably at least between $30,000 to $40,000 worth of nutraceuticals by various companies. And they're not magic. You know, the idea is a supplementation. From a doctor's point of view, you just have to make sure it's clean, that it has what it says on the label, and then different sources, even different companies, will make the same item, and sometimes it absorbs differently. But in a physician's office, where you're dealing with optimal aging or even cancer patients, you have to make sure things are clean, or patients with cancer. But just the whole request of what we're seeing, I mean, you wouldn't see from 25 years ago, supplementation 40% to 2006, 2012, today 62%. It's not just a fad. Again, things are being demanded by the public. They want more answers. They're not just happy getting a drug or a surgery for everything that happens. And I'm not saying that drugs and surgeries are bad, but they should be, again, the last resort. And people are not just happy noticing that they have a pill for everything. I mean, if you have a whole list of prescription pills or a whole list of vitamins, I think I'd still rather be doing vitamins than the prescription pills. In fact, you don't go up to the person that looks the healthiest and run up to them and say, how many prescriptions are you on because you look so good? You don't value health that way. So we actually have to take a look at that. So we're seeing this need or this trend or this revolution, which again is asking for supplementation because it gives them power and it creates a vitality around them. I mean, how my dad aged, even though my dad's still around. I mean, if I looked at him, how I look when I'm almost 50, and how my dad looked when he was 50. My dad didn't have any teeth when he was 50, and he had to eat. I still love my dad. There's no daddy issues here, okay? But my dad ate cheese whiz out of a can and drank coffee, and when he said to me, look, you know, I wouldn't expect. I like to be thinking at 70 or 80, I'm going to be still doing the grouse grind. That was not an expectation back then. And so it just comes to play that we have a lot more power, we have a lot more resources. And knowledge is power, but again, only if you take it and only if you use it. And we're always seeing still a trend in even the healthcare workers. And these are people that are supposedly anti-vitamin, and they're still taking vitamins. They're still taking some kind of complementary therapy. So it's definitely needed, and it's definitely a resource. And of course, that is one of the main product lines of Truestar. And I will tell you something about the Truestar, is that Truestar and Tim, they got together with another company that I have been using in my clinic for almost 20 years. So they're what's called a professional grade. Professional grade is the same grade you'd use for a patient. So that's very rare to have that available now to the public. And it's a little different. Not magic, but more specific, more clean. So let's go through what we mean by deficiencies. Deficiencies, it just means that your bodies and your cells and your tissues and your organs are not getting what they need. And they're not going to die just with one. It takes more than one thing to kill a person. But it's an accumulation over years that actually hurts us. And when we say what hurts us is that if a cell is not getting what it needs, if that brain tissue isn't getting that CoQ10 or that antioxidant, well, it's going to die faster. That's all it means. If your cells are starving, they're going to die faster. That's what that means. Free radicals, inflammation, we've heard that deficiencies. So deficiencies really mean that you're not feeding the cells and tissues and organs. And over time, those deficiencies create what we know as chronic conditions. 90% of most conditions are related to some kind of deficiency or excess of something that obstructs health. So we see deficiencies. In one way, the deficiencies are simply coming because even if you ate organic, the food and the soil that the food is grown in is nutritionally depleted. So oranges, apples, things that we used to get, even if it's organic, do not have the same nutrition. That's number one. Next is what we're feeding ourselves. Even if we eat supposed to be perfect, we still expose ourselves. Take a look. 1/4 of all vegetables consumed in this country are eaten as French fries. There, we're being exposed to certain foods. And we're seeing this. So what we got is we're not, first of all, getting enough nutrition. First off, because we're not getting it from the soil and the foods, and also we're choosing choices that aren't as good. And we're also having deficiencies being created by what's being ripped from us. The average person has several hundred toxins floating around in their body. Well, actually more so floating around in their fat tissue, because if your body doesn't know what to do with a toxin, it just creates more fat. Most people don't know that fat is a reservoir for toxins. That's why it's so essential, no matter whether I do an optimal living plan, an anti-aging plan, or a weight loss plan, or a detox plan, they're all the same. They involve prepping the body to start getting rid of some of the toxins. A person, the hardest part is going to the gym. You imagine going to the gym, you burn your fat, but you don't have the nutrients to supply the liver, kidney, and all the detoxification organs. What typically happens is your body just goes ahead and recycles back and makes fat again. So a lot of people will work out, put the time in, but they haven't done the nutrients to make sure they facilitate the removal of the toxins. So pollution and toxins. And then, of course, this one, stress. Now, the stress of a happy life is different than the stress of an unhappy life, but stress just means change. And so we have physical stress. For instance, if we run a marathon or we get exposed to too much cold or too much hot. We have environmental stress like pollution and secondhand smoke. We have physiological stress like when our blood sugar drops. And of course, we have emotional stress, which is when we think. How many people stay up too late at night thinking? Your mind's racing. Trust me, last night I'm thinking about the seminar going, I hope it rains so people can find parking. I'm sorry, I was wishing for rain, so terrible. But how many times when our mind is so powerful. And by the way, when I talk, I actually talk as if my mind is separate from me, because it is. There's me and there's my mind. Most people don't know they even have a difference. And my mind is like a computer. It's very fast and very quick, but it's never thinking about winning. It's just thinking about not losing. It's always trying to be safe. So mind can race, but unfortunately, or fortunately, my mind is attached to a body. So if I'm thinking about something that worries me, my mind doesn't know the difference. It still raises my blood pressure, still increases my cortisol, it still increases inflammatory cytokines, so that if I get, supposedly from archaic days, if I got cut by a dinosaur, that I would heal faster. All of these things are set to called survival mechanisms. And of course, weight around the midsection. Do you know that we gain weight because our body thinks we're in trouble? A body at peace does not hang on to weight. And even though technically I've said weight loss, it's not weight loss. It's really that your body lets go of fat because it doesn't need to protect itself anymore. So when we think of stress, that's one of the biggest and largest things that is modifiable with this program, but also that steals nutrients away. A little bit of damage control. Seatbelt before the accident, I call it. That's a little bit. So Truestar answers that outcome. And in 2004, Truestar developed a whole line, and it covers almost every physiological type of condition or chronic condition. So they've got a nice broad spectrum of line. And I know Tim personally. I met him 10 years ago, the owner of the company, and I consulted with him. And then I came back into his life really coincidentally, and to help him with what's called be part of an advisory board. And also take this portal and create what's called a patient portal, so it tracks more data. So we'll have better meal plans. So we'll have even more products. So I like it when, for instance, an owner of a company, if I text him, he'll text me right back. And when we make changes, they happen within a couple of weeks. You don't get that anywhere else. So top-rated supplements. I don't mean internally top-rated. I mean from an external source. As Leslie mentioned, this is called a NutriSearch Comparative Guide. And this Lyle McMillian fella, this guy has been a consultant for several nutraceutical companies, but he's also worked for Health Canada, and he was the one that helped with natural product regulation that ensured that what was for vitamins, what was on the label was actually in the bottle. So that's why it's a highly reputable source, and Truestar got rated as a 5 out of 5, number 1. And that right there means something. But I knew that already because, again, the people that make Truestar vitamins are a doctor's grade. It's set up to treat. So let's go over here. So my wife thought of this idea, so okay. Remember how we used to have the milkman delivering the nutrients for the day, right? I don't know if you remember that. I'm from Alberta. We used to have those little slots where you put the milk in. You wake up and all of a sudden it's there again, right? So just as much as, and I do this what's called an eco-friendly type of thing because I asked for a company before Truestar came, I put it on my vision board, to create some kind of portal. And I had hired people to start creating this to track data so I could start to figure out more effectively what works. And I also got tired of carrying pharmacy, that either you carry too big a pharmacy or people had to come in and pick it up and then they would want it shipped out. And it didn't seem eco-friendly anymore. So I like it now that with this kind of system, whether it was from Truestar Health or one I was going to create on my own, again, probably a little longer would have took me, okay, that now we have our modern day milkmen, okay? And that's what, and our milk is not milk anymore because milk's not so friendly anymore. It's not such a healthy thing. So, but our milk, our nutrients at this day are supplementation to make sure we're not deficient, person-specific supplementation. So that's what we're looking at is the modern day milkmen. Here are is, who's seen this graph before? All right. All right, so 0 to 100% on the left hand is health. On the bottom is your age. Just because it says 90 doesn't mean you can't live past 90, because technically, genetically, we're supposed to live to up to 130. I don't know anybody who's lived to 130 yet, but that's genetically what our cells are able to do. All right, now, we don't want to live around if we don't feel good, so it's always about vitality. So here is most likely everyone, optimal health. We can do anything we want to our body up till about 30. And sometimes if it's fun, you do it twice or 3 times, okay? But, and your body is very forgiving, Not everyone. Okay, thank you, honey. Okay, and then declining health over and over again, poor health, more disability. This is where you start to go to a doctor. This is where you'd start to get symptoms. Maybe you're not bad enough to be registered on a test. Maybe you're not bad enough to inherit a name called a disease. So either way, you'd see this declining health. But this is what we call the real normal curve. Before, go, 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 feel good, drop. So you have a high amount of vitality, quality of health, and that's what we're looking for. Now you see that big gap in the middle? This is called optimal aging. Going from this line to this. Going from what's a common thing to really, this is a normal line. This is what we should be at. And how you change that is through diet, through exercise, through dealing with any kind of different deficiencies, usually with diet again or nutraceuticals, attitude, how you think, and of course, rest. And what does that sound like? Exactly what I've been doing in my clinic, because that's why TrueStar is aligned with optimal aging principles, which I have been doing for 20 years. And that is what TrueStar, again, is aligned with. It's one of the reasons why I'm so passionate, why I like it, why I hosted the event. Simply because it's the same as what I've been doing, except now it's automated. I like this viral effect. I don't like the virus name, but this whole marketing viral effect. Positive virus where you can help more people at once. I can only help one person in front of me. With this kind of system, I can help several people at once. And that's the whole idea. Because we need more help, more love, more attention, again, more purpose. So with that, oh, sorry, thank you very much. Thank you. That would be a clap. All right, I'm going to bring up, okay, we're going to bring up kind of a Canadian icon. He's going to talk for 10 to 15 minutes, and then we're going to take a break, okay? And you've seen him, he might run in right now, participation. Who knows the words? Okay, this is Hal Johnson. He's come all the way.